So let's kick off this explainer with a really simple question. Have you ever noticed those little transparent cobwebs just kind of floating across your vision? You know the ones. We all get them, right? And most of the time we just blink them away and totally forget about them. But what if I told you that sometimes those tiny little annoyances aren't just harmless specks of protein?
While they're usually harmless, today we're actually going to treat the eye like a crime scene. Because sometimes those floaters are literally the very first clue of a major biological break-in. We're looking at a scenario where your eye is actually giving you a vital, flashing warning sign that a systemic invader has breached your body's defenses. It's a fascinating and, honestly, a slightly unsettling medical mystery.
So, welcome to our explainer on the biological true crime of posterior uveitis. Let's dive right in.
To start our investigation, we really need to define our crime scene. Posterior uveitis is basically an inflammation located strictly behind the vitreous base. Think of that as the clear, jelly-like substance filling up your eye. This affects the deep structures, the choroid, the retina, and the vitreous itself. And here's the catch. Unlike a sudden, painful, super red eye, this is chronic. It's a slow-moving condition, which means the damage is happening gradually, almost entirely silently.
Now, the absolutely crucial point here is this golden rule for eye care professionals. You literally cannot simply diagnose an issue at the front of the eye, like anterior uveitis, without absolutely proving the back of the eye is completely clear. You have to look deep. You've got to investigate the entire scene to make absolutely sure you aren't missing the root of the problem, just hiding back there in the shadows of the retina.
In this particular medical mystery, there's a pretty strict division of labor. Think of the optometrist as your lead detective. Their job is all about detection and making the right referral. They're the ones spotting those super subtle clues. Then you have the medical doctor or ophthalmologist acting as the closer. They're the ones who actually diagnose the specific systemic condition, map out the treatment plan, and prescribe the heavy-hitting meds. So, the optometrist detects and the MD treats.
So that brings up a really interesting question. What kind of clues are actually left behind at the scene? When a patient comes in complaining of cloudy vision or floaters, especially when there's obviously no cataract to explain it, our detective has to peer right into that vitreous fluid to see what the inflammation has left in its wake. Looking deep into that clear jelly of the eye, the detective might spot some incredibly bizarre evidence. We're talking inflammatory debris forming these small gelatinous clumps that are literally called snowballs, just floating near the bottom. Or, even more dramatically, a thick gray-white wall known as snowbanking. And honestly, here's the kicker. This buildup often sits so far forward in the extreme periphery of the eye, the optometrist actually has to gently press on the outside of your eyeball just to get a glimpse of it. Crazy, right?
Okay, so once these signs are spotted, it's time to round up the usual suspects, and they generally fall into two main gangs. Over on one side, we've got the infectious invaders. We're talking heavy hitters like syphilis, tuberculosis, various fungi, and parasites. Then, on the other side, you've got the inflammatory gang, disorders with really mysterious origins like sarcoidosis. It's a pretty massive and intimidating lineup.
Now, we could honestly spend hours analyzing every single one of those suspects. But today we're profiling the absolute most common infectious mastermind behind this whole condition. When it comes to infectious retinochoroiditis, there is one villain that completely dominates the charts.
And this quote right here brilliantly illustrates exactly why we care so much about this specific villain. As our source material perfectly states, any organism that shares our brain with us deserves our attention. Let that sink in for a second. This isn't just some run-of-the-mill eye bug. It's a parasite with a very real affinity for our neural tissue.
Say hello to toxoplasmosis, or T. gondii. This is a highly resilient single-celled protozoan parasite that was actually first discovered way back in 1907, hiding inside a small North African rodent called the gondii. Fast forward a bit to 1939, and congenital toxoplasmosis with ocular involvement was officially recognized as a human disease.
So why is this villain so incredibly successful? Well, it's because it actually has two very distinct forms. First up, you have the active form. That's the one causing the actual inflammation. But as soon as your host immune system starts fighting back, it pulls a fast one and converts into its second form, a terrifyingly stealthy cyst. This cyst is tough. It survives our stomach acids, and once it settles into our tissue, it becomes completely impervious to both our immune system and literally any drug treatments we throw at it. The parasite just chills out inside its little armor, neither killing the host nor being killed by it.
Let's trace how this infection actually builds, because I gotta tell you, its life cycle is absolutely wild. Step 1. The parasite absolutely requires the intestines of a cat to reproduce.
The feline is the primary animal reservoir. So millions of these cysts are shed in cat feces, which then goes on to contaminate the soil and water. From there, it infects livestock like pigs and sheep. And finally, humans enter the picture by either eating undercooked meat infected with these cysts or just by snacking on unwashed fruit that was contaminated by the soil.
Yeah, you heard that right. Beware of cat feces. We are not dealing with fragile little organisms here. These incredibly tough cysts can just sit out there in the soil, totally viable and waiting to infect a brand new host for literally years. This right here is exactly why basic hygiene, scrubbing your fruit, and making sure your meat is cooked thoroughly are your absolute best lines of defense.
Now, the story definitely gets a bit darker here. While an adult with a healthy immune system might just fight off that initial infection, there is a massive, massive danger to the unborn. If a non-immunized woman, meaning she doesn't have any protective antibodies yet, is infected right around conception or during pregnancy, there is a whopping 40% risk of transmitting the parasite straight across the placenta. And remember how we said it loves neural tissue? Well, it targets the fetus directly, which can tragically result in stillbirth, multi-organ disability, or severe neurological and visual complications down the road.
But if we're talking about the average adult with a healthy immune system, there is a twist, and it's probably the most shocking one in this entire medical mystery. A staggering 80% of systemic toxoplasmosis infections show absolutely zero symptoms. None. That means 8 out of 10 people infected wouldn't even have a clue they have it. The remaining 20%? They might just experience a really mild flu-like illness. You know, a bit of fever, maybe some muscle aches, a sore throat, or a rash. Honestly, you'd probably just brush it off and think you caught a mild bug. But here's the thing. You didn't just catch a bug. You picked up a lifelong passenger. Those tough little cysts, they just lie happily in your heart, your muscles, and yes, even your retina, causing this chronic, hidden infection. They literally just sit there silently, biding their time, waiting for the day your immune system declines for whatever reason. And if your defenses do drop, the cyst wall ruptures, the organism is released back into the wild, and it kicks off a brand fresh spot of inflammation that leaves behind a scar on the retina and can potentially cause blinding posterior uveitis. We started this whole thing off by talking about simple, annoying little floaters. But look where we ended up. We've uncovered a microscopic mastermind that manipulates cats, survives for years in the dirt, completely evades our best drug treatments, and hides silently in the neural tissue of 80% of its hosts without making so much as a peep. So, I'll leave you with this. The very next time you see a tiny floater drift across your vision, you might just want to ask yourself, what hidden mastermind might be sharing your brain right now?